Welcome to Adapting Class Chest Tube. Everything you need to know for your nursing school or NCLEX. Stick around and watch this. Very short information, but high yield fact that you need to know. Straightforward. So before that, let me tell you what the chest tube will look like. We don't, everybody call it chest tube. I usually call it ProVac. It's a machine, basically, it's a vac with different segments. It has three segments like that. The first segment is where suction comes through. So this is the suction chamber. And the second segment is this is the water seal. So we have water here like that to seal air from going back into the patient. And this is the collecting chamber. Basically, this is connected to the patient. If this is the patient, it's connected to the patient chest. This tube is what we call chest tube. And this is what we call ProVac. It's a Pro vacuum. So that is the rare chest tube. But everybody refer to this machine, which is what we call Pro vacuum as a chest tube, but the actual chest tube is a long tube. It has different sizes. You have 27 French, 37 French, 28, 38 French, depending on the need you have to use it. And this is what go to the individual chest and it connects to the pleural vac. And so there's a collecting chamber, collect stuff, air or fluid, and then this air seal prevent fluid or air going back into the patient, mostly to suck all the air out, and then you give it to the suction chamber and it suck out of the system. So it's a closed system. This is the summary of that. Your NCLEX want you to know how to take care of it. Your nursing school want you to know how to take care of it. Every segment you're supposed to know. So what kind of assessment finding do you need to do when you have a patient who has chest tube? Well, you should assess their respiratory status because it's helping with their lung function. So you want to know their respiratory status, how they breathe in, how they coughing, and that other thing. You monitor the drainage type. You want to see the consistency, the color, the amount, the time is coming out. If you stop draining, you know there's a problem. Okay, you also have to assess for leak, right? There's a air seal chamber, so you assess for air leak. And this is usually you see continuous bubbling. So continuous bubbling in the water seal chamber. When you see that there is a hair leak in the system, you also want to check the tube for kink. So kinks are not good. You check for loops, okay, and cuts in the chest tube. All these things prevent obstruction, even clots. You want to make sure that none of them is in the tube. You also want to monitor for subcutaneous emphysema. Um, Basically air is escaping under the skin, right? Like emphysema, COPD, air trapping, it's the same thing, subcutaneous air trapping. You can change it. If you don't know what emphysema is, it's subcutaneous. That means under the skin, air is being trapped. Same thing, COPD, air trapping is subcutaneous emphysema. How does it feel? You feel like Rice Krispies. If you push on it, that's what it feels like. And you hear sound, making sounds. Those are the things. So these are assessment finding you need to do when somebody have chest tube. Then what do you need to do? Expected and unexpected finding. Your board like to ask you. These are classic expected finding. Tidaling. That means you have rise and fall. Rise, fall in the tube. In the tube, not the ProVac, the tube that connects to the individual chest, or you can see it in the ProVac too. Both the tube and then in the ProVac, you see rise and fall when client is taking breathing. So these are when you see it, this is an expected finding. Second expected finding, sometimes you can see intermittent bubbling, okay, in the water seal chamber. That is okay in the water seal. chamber. That's okay when the chest tube is placed for pneumothorax. You can also see some intermittent bubbling in the suction chamber sometimes. I mean, if it's designed to be, there's a wet suction chamber, so you can see intermittent, or I'll use the word gentle. Gentle for this one. Gentle bubbling in the suction chamber. If it's a wet suction system, because it's bringing suction in the system to pull things out. So that's unexpected finding. What is unexpected finding? What do you think? Unexpected finding in the chest tube, prorovac, is where there's the continuous bubbling in the water seal chamber. You're not supposed to see that. When you see that, you know that there is an air leak, right? Or if there's a sudden cessation, okay, of tidaling, there's no more tidaling. That means there's no more rise and fall. This may be obstruction, indicate obstruction. Or if you have excessive drainage, greater than 100 ml per hour, you got to call the doctor. That's something that you should know as much as possible. And the quality of the product, if it's the bright red and blood, that means the patient may be bleeding. That also bad, unexpected finding. You need to call the doctor. When you're taking care of the patient, what are your priority and functions you need to do? Okay, keep the drainage system below. Okay, below the chest. It has to be below the chest so that it can act as a drainage system. This will prevent backward flow. So keep it below the chest level as much as possible. So you have to encourage deep breathing. Okay, repositioning once a while. These are all, and then you tell the patient to cough. These improve their lung function. Very, very important. These are testable questions. If the tube, that means the chest tube came out from the prorovac, chest tube out of the prorovac, that is the chamber I told you about. It came out from the prorovac itself. What do? You place the end, you cut the end and then place it in a basin with 250 ml of saline or sterile water. This will create a new water seal chamber. If the chest tube came out from, if tube, okay, came out from the patient, not the prorovac, then you got to tape the site on the client's chest with occlusive dressing, but you tape it at 3 sides to act as a flutter valve and allow air to escape. Very, very important. Do not clamp the tube without an order. Even if they give you an order to clamp it, make sure it's less than 1 minute. That is very important because you can clamp it to change the prorovac, but it has to be less than a minute. Very, very important. What are complications that can happen with chest tube? It's due to blockage in cardiac tension pneumothorax. So these are complications. One is tension pneumothorax. Basically, and it's due to blockage. What do you see? You see the tracheal deviation. You see tracheal deviation. You see respiratory distress. You may see hypertension. Okay, and then the decreased breath sound on the side that is affected, but there is no change, so decreased breath sound. But there is no change in their heart sound. Don't get trapped. That's the cardiac tamponade. So that is very, very, very important. One thing you have to know, I said it, so I just want to say it again, is there's different kind of suction chambers. The suction control you can have, this is suction control. Okay, you can have a wet system, a wet suction, where you will see water is in the system. So water to control suction. We use water to control suction. So this is where you see the gentle bubbling. So this is an expected finding. If it's not a water suction control system, it will be a dry suction. The word will be dry. Look for the word dry suction. And if it's dry, there will be no bubbling. So this is a dry suction system. So all you see, we use a dial knob to change the suction. Okay, so we don't use water to direct us. And in that process, no bubbling. You're not going to see no bubbling at all in this chamber. Okay, and the last thing I want to say, I'm running out of space, but I'll put it here like that. Something that you should be aware of, maybe use different color, is when do you remove the chest tube? During the process of removing the chest tube. So chest tube removal. Chest tube removal. Let me use this. So chest tube removal. Well, you got to pre-medicate the patient, pre-medicate, keep their medication because it's painful. But the most important thing is this, Valsalva. You let them what? Hold your breath and bear down during the removal. They should not be breathing. This will prevent the lung from collapsing again. And then after that, apply occlusive dressing. And then you monitor the client respiratory status um, after the procedure. After the procedure. This is what you need to know. If they ask you, must have information at bedside, well, you're supposed to have a basin. You're supposed to have 250 ml of sterile water and a non-crashing um, clamp, and finally sterile wipes to wipe the tube as it fall out from it. This is chest tube NCLEX content. Assessment you're supposed to know, complication, expected finding, unexpected finding. What kind of suction system do you have? What do you do when you remove the chest tube? What are your priority function? Take care of yourself. And thank you for watching.